If you or your child suffer from dryness inside the nose or have thick or crusty mucus, then the Saline Mist Spray, Non-Aerosol, can be helpful. It adds moisture inside the nose to help dissolve and soften the mucus. This can be particularly beneficial for babies and young children who have stuffy noses and cannot blow their noses. Using this product can make the mucus easier to remove with a nasal bulb syringe, helping to relieve stuffiness and make breathing easier. It's important to note that this product contains a purified gentle salt solution, also known as saline or sodium chloride solution, and does not contain any medication. So, it can be used safely for anyone who needs relief from dryness or stuffiness in the nose. Just a few sprays each day can make a big difference in providing relief. It's recommended to use the Saline Mist Spray, Non-Aerosol at the optimal time when needed, such as in the morning or before bed, to help keep the nose moist and comfortable throughout the day. When using the Saline Mist Spray, Non-Aerosol, you can spray it into each nostril as needed or as directed by your doctor. It may also be given into the nose as drops or a stream. Be sure to follow all directions on the product package. And remember, try not to touch the container tip to the inside of your nose. If this happens, rinse the tip with hot water and dry with a clean tissue before recapping the container. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. This spray is safe to use daily and can be used multiple times a day, especially during allergy season or when experiencing nasal congestion. It's best to use the spray when needed, and the optimal time to take it is when you feel nasal congestion or dryness. When using Saline Mist Spray, Non-Aerosol, side effects are unlikely. However, if you experience dryness and irritation in your nose, you may feel a stinging sensation. If this persists or worsens, it's important to consult your doctor or pharmacist. If your doctor has recommended this medication, it's because they believe the benefits outweigh the risks of any potential side effects. Most people who use this medication do not experience any serious side effects. Although rare, a severe allergic reaction to this drug is possible. Seek immediate medical help if you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects, so if you experience any other effects not mentioned here, it's advisable to seek guidance from your doctor or pharmacist. For those in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this Saline Mist Spray, Non-Aerosol, it's important to consult with your doctor or pharmacist if you have any allergies or if you are using any other medications or herbal products. It's also important to inform your doctor or dentist if you are planning to have surgery. This product is safe to use during pregnancy and while breastfeeding. As always, consult with your healthcare provider before using any medications during these times. When using this Saline Mist Spray, follow the recommended dosage instructions and use it as needed for nasal congestion or dry nasal passages. It can be used at any time during the day, whenever you feel the need for relief. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek approval from your doctor. No cases of overdose have been reported with the use of this product. This Saline Mist Spray is used to help relieve dryness inside the nose. It can also be used to help relieve nasal congestion and to moisten the nasal passages. The recommended dosage is usually 2 to 3 sprays in each nostril, as needed. It is best to use this spray at regular intervals throughout the day, or as directed by a healthcare professional. It's important not to share your Saline Mist Spray, Non-Aerosol with anyone else, as doing so could increase the risk of infection for both parties. This product is designed for individual use only. You can use Saline Mist Spray, Non-Aerosol to help moisturize the nasal passages, relieve nasal congestion, and help reduce dryness in the nose. It can be used as often as needed throughout the day, and is safe for both adults and children. It is best to use the spray when you feel nasal discomfort or dryness, and it can be used before bedtime to help with nighttime congestion. Be sure to refer to the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not flush this product down the toilet or pour it down the drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.